interproximal root caries scenario. So this one I'm going to show you from start to finish. You're going to see the beginning and end. These are tricky, and they'll never be easier. And patient came in for routine bite wings, and you can see number 4 has one, and number 30 does as well. But we're going to focus on the number 4. And so when we get into these cases, like I was saying, the weird physics, right? So we get into these root caries, and why are root caries so hard? You know, and part of the reason is they're hard to restore, right? So a lot of times our tools start to act a little bit outside of what we're expecting them to behave like. And when that starts to happen, then things get real really fast. And so finding something that can just kind of bail us out of this is key, and wedging these is the big issue, to be honest. And so let's show the preparation. And we're familiar with this. And again, I take pictures with the raw, right? So this is what it looks like. I'm not going to clean all this up. I'm not going to put hemostatic agent here and pretend like, you know, that we're magical in our hemostasis and everything. It's like, we open this thing up, this is what we see, right? We got bleeding, we got subgingival, we've got a kind of a weird shape, and that extended a bit to the palatal here. So this can be a bit of a tricky situation, and matrix insertion can be tricky here, wedge insertion, you know, which way you're going to go. And ultimately the big one is at the bottom here, you know, hemostasis and quick control. And we need to be able to isolate this quickly. We need to be able to do it in one shot, and to be able to get in, get done when we need to get done, and get out. So this is the posterior matrix system inserted. And now when I inserted it, you can see that, you know, you can see the marginal ridge built in here. This is a pretty good shot of this. And when I inserted it, I noticed that my contact area was kind of open because the molar was heading in a bit of a different direction. So my matrix system had to follow the contour of the tooth, right? The preparation, which was essentially on root surface at this point. And my matrix band, despite trying to reach all the way over there, didn't quite make it to a super closed or as broad of a contact that I would like from the mesial or the buccal lingual dimension. And so what I did was placed a ring on it. And this is the Wago matrix ring. And it is I think it is autoclavable, and Jason will touch on that later. I'll let him answer that question. And I think you can get a few uses out of it, but it's a V, you know, it's kind of like a V ring, very similar to Triodent, Palodent. And so you can see that all I did was, when I placed the ring on, I engaged the wing of the wedge that was attached to the matrix band. And you can see the other wing here is just somewhere in the middle. It's just hanging out under the V. The other side went over the handle. And so when I placed this ring, now you can see that my matrix band was able to be approximated to the neighboring tooth. And that allowed me to make sure that I got a proper contact. So again, I'll go back to this slide so you can see here and appreciate that the matrix band was being pulled away from the tooth due to the shape of the preparation and the fact that it extended palatally. So I placed the ring on top just over this wing, and that allowed the matrix band to touch the neighboring tooth. And this is immediately after that visit. And so you can see that we have our contoured restoration here. It follows the original form of the tooth, didn't have to deal with any overhangs in this area. And again, just one of those situations that can kind of drive us crazy, and unique tools for unique situations. And the radiograph at the end, you can see here, real nice seal here at the gingival margin, and nice contour. And you can see how it kind of mimics the mesial contour of that tooth as well. And once the papilla and everything kind of heals in there, it won't be quite as big of a triangle. But when you have patients with periodontal, you know, issues, and you have these shapes coming from these directions, you're going to get triangles. And so just trying to get a real nice proximal contact here and really good gingival marginal seal, and encourage excellent, you know, oral hygiene to help keep those margins clean.